North York General is a campus of care, which means we have a number of different sites. One of our sites, so we're an acute care hospital, one of our sites is actually a long-term care home, but currently our information does not flow between our organization and our sister long-term care hospital. So what that means for a patient or for a provider, if we discharge somebody from the acute setting to the long-term care setting, that long-term care doctor literally needs to pick up the phone, call our hospital, and get the patient information, which is a very archaic way nowadays of communicating. So we talk a lot about our healthcare system, and it's not a system at all. And what I mean by that, specialties within medicine and different parts of the patient journey are dealt with by different partners and agencies, and none of our systems are connected. So this particular project is about how do we connect that patient journey? How do we make sure that that information flows with them as they go through their care journey? So how this project is actually going to help with the seamless flow of information across our system is the Ontario eHub is going to take the information that resides in our Oracle Health system, and it's going to make it available to providers across the continuum. It means that whether you are in acute care, community, mental health, etc., you are going to be able to access information about patients in a single point of reference. And so this information is going to be standardized. It's going to have pertinent information, and what makes this very unique and exciting is that the information is going to be actually embedded in our clinician workflows at a point where it makes sense. So historically, our clinicians have had to go out of their main health information system, log into a different system, or log into a patient chart to be able to gain access to this information. With the Ontario eHub project, that information is going to be seamlessly embedded and as part of our clinical workflows. Our work with Oracle Health has been fantastic, and what I think makes it unique is our relationship with Oracle Health has allowed us in this particular instance around the Ontario eHub to really leapfrog some of our peers that are on alternative systems. And because primarily they've already had this functionality in place, they've been able to deliver this vision around a connected care ecosystem in other jurisdictions. So we have seen many of our peer hospitals that are on alternative solutions where they're needing to work with their vendors to actually code and develop the solutions from scratch. We were able to really leverage the experiences that Oracle's had in other areas of the country. And it's not only from a technology perspective, we have also been able to talk to our peers in other areas of the world to have them come in, share their lessons learned and their lived experiences, and they're only a phone call away. So this partnership with Oracle Health to deliver the Ontario eHub has been an extremely positive one.